So DecisionDx-Melanoma helps me manage my patients in two specific ways. I have a pre-operative use and I have a post-operative or a surveillance use. If we look at the pre-operative first, using DecisionDx for melanoma helps me manage my patients to determine who I may or may not perform a sentinel lymph node for. For instance, if I have a young patient who had a biopsy and say the biopsy showed a 0.6 millimeter melanoma, the base was transected, I have some fear based on their youth that maybe they're at higher risk of spread, I would order the DecisionDx test for melanoma to help me stratify them for high or low risk for a sentinel lymph node. If they're at a higher risk, then that's going to push me to offer them a sentinel lymph node biopsy. And if they're in the lower risk category, then I can with some confidence say that we're going to be good, you don't need to do the sentinel lymph node biopsy. On the flip side, if I have an older patient with significant comorbidities who may have some difficulty with general anesthesia, I may order this test and say, are you at high risk where we should undergo the anesthesia, the risks of that, or are you at low enough risk where maybe I don't have to do a sentinel lymph node biopsy? Now, the second half, if we're looking at the post-operative or the surveillance side, the DecisionDx test for melanoma is a test I use for the vast majority of my stage 1 to stage 2 patients. I feel that understanding a patient's biology of their cancer helps to identify who may be at higher risk, and then I would know how closely I should follow them over the next few years. Am I going to be doing cross-sectional imaging? If they're at higher risk, am I just going to be doing clinical exams if they're at lower risk? So using the DecisionDx test for melanoma helps me manage those patients in the post-operative setting and in the surveillance phase.